I interviewed Dr. Mike Giunta, physical therapist and head medical director for the newly formed Premier Lacrosse League, or PLL, that just finished its inaugural season in 2019. Not only is the PLL unique in the sense that it is run and managed by the players themselves, but they also truly see the value in physical therapy, which is why they brought on Mike, the physical therapist, as their head medical director. Mike discusses his role within the PLL, the importance of interdisciplinary care, as well as his career path to that position. He also shares his recommendations for how up-and-coming clinicians or students can follow in his footsteps. For anyone interested in sports physical therapy lacrosse, you are going to love this one.
The Prehab audio experience will teach you how to take control of your health through knowledge by optimizing performance, promoting longevity, and keeping your movement system in tune. Welcome to your host, the Prehab guys.
Hopping on the Prehab audio experience today, I have Dr. Mike Giunta, the medical director for the Premier Lacrosse League, head physical therapist at the Burton U.S. Open of Snowboarding, and CEO of Evolution Physical Therapy in Los Angeles, California. Mike, how's it going today?
Oh, it's going awesome, Mike. How are you?
Good. I appreciate you coming on. I'm really excited for this. For those of you that have not been aware, the PLL, the Premier Lacrosse League, had its inaugural open year in 2019, and Mike is the head physical therapist, the medical director for the PLL. So I wanted to get him on here to talk
all of the above.
All of the above, yeah. More about what the PLL is for those of you that don't know. For those, it's Premier Lacrosse League, his relationship with them, and how physical therapists like Mike have gotten involved with the league. So with that, I guess we can start with what is the PLL, and I guess how did it get started, and how is your involvement with the league?
Yeah, absolutely. And the PLL is the Premier Lacrosse League. So it got started in its inaugural season this past year, and is really kind of a brainchild of a former and current player, Paul Rabel, and his brother, Mike Rabel, who, basically thought that this sport could just be done in a completely different way. And so they set out to branch off of, the incumbent league and form their own league, more or less. And the basic idea of this league, which I think is important to bring up, is just that it's extremely player-centric, and really focused on the athletes and, everything that goes along with that. So, so that kind of concept is taken all the way from the front office, all the way through our role as the medical team out there.
When you say player-centric, what exactly does that mean for maybe someone that doesn't know how traditional sports are mainly managed or run?
Sure. I think, every single thing that happens in the PLL is done with how it will affect the individual athlete. And I think that's important. I can't speak on how every traditional sport is run, but I think a lot of times they're run, a little bit more like a business, right? So whatever is best for the business, even though that might come at the expense of, what the athlete is doing or feeling, that might happen. So every action that's taken by this league is done with the athlete in mind and what will be best for them. And in this model, it is very different than the traditional model where all 6 teams are actually owned by the league, and they're not geo-centered, meaning they don't have a specific city attached. And basically the league just travels from city to city throughout the year, and all the teams play on those given weekends in a given city.
That's a really cool model. I didn't realize that the teams were owned by the PLL, which I guess goes to your point of saying that it's very player driven, because there's not external, I guess you could say, competing owners or something like that want something different than what the players may want.
Yeah, absolutely. And then also everything trickles to the entire league, right? It can't be just one individual owner taking stock in, a certain aspect, and then that not being able to trickle to the rest of the league. I think we see those examples in, some of the NBA teams early on that started using sports science and, that sort of stuff to improve their players. But it was almost like a secret for one team to improve, where in this sense, we actually don't give any preferential treatment to any specific team. And when we roll something out, it rolls to the entire league so every single athlete can get the benefit of it.
That's awesome. So your role as medical director then of the league, I assume that means that you're in charge of all the players, all the teams. Is that correct? Is my understanding?
Yeah, absolutely. All the players, all the teams, and then all the staffing that kind of goes along with that.
So how does that work for you? I guess I know it's off season right now, but I guess we can say, or maybe how does that look for you right now in the off season in comparison to like, when the season's going up, like traveling, or what are you doing on a day-to-day basis with rehab or managing, and how does that look?
Sure. So in the off season, I mean, it's pretty new into the off season right now, where we just finished up the championship game about a month ago. So I think we're pretty hot and heavy still on managing some of the injuries that occurred throughout the season, and just checking in on guys to make sure that their rehab is going well. If they don't live in Los Angeles or Connecticut, which are the areas that we have our individual clinics, we want to make sure that they're getting really appropriate rehab or other medical treatment in those areas as well. So a lot of times it's, doing conference calls with different physical therapists or different athletic trainers, orthopedic surgeons, whoever might be implementing the treatment plan. We're, talking to those individuals and making sure that our athletes are getting the best possible care out there. Additionally to that, I am basically searching for a lot of the best products or kind of state-of-the-art practices that we can use. So whether that's, a better EMR that we can be using to, potentially different, products like CBD oils that might help our, athletes recover better, other recovery products, other performance products. I'm more or less being that stopgate to make sure that anything that's going to be used by our athletes is absolutely top of the line. And then aside from that, I'm just interacting with the league to make sure that, we have all of our I's dotted and T's crossed, and that we're going in really strong to the 2020 season.
That's awesome. So I know, so you're also the owner of Evolution Physical Therapy, which has clinics in Los Angeles and Connecticut, like you mentioned.
Yeah.
So it sounds like a lot of the players are rehabbing with you there, and then you're coordinating and managing players that live outside of those regions. Are there a lot of people that live outside of there? A lot of people are around those areas, or?
Yeah, so, the big hotbeds that we've identified really are New York, Baltimore, and Los Angeles. Those are the three areas that I think most of the players are kind of gravitating towards. So we're establishing our partnerships in those areas to ensure that, we're getting the best possible care. So again, I'm constantly talking to physical therapists and making sure that, their treatment practices are kind of up to par with what we would expect. Unfortunately, there's often times where we actually pull a player from, one place where they're getting treatment and put them in another area where we feel like they can be most successful. And, I think that comes down to just the overall idea of what physical therapy is and how it's being delivered, and making sure that, we're challenging other physical therapists to, really perform best practices and use, the best technology or the best treatment practices that are out there and available to us. So, unfortunately, if you're not practicing in that way that I think gives our guys the best ability to succeed, then we're going to find somebody who is practicing that way. It might be a systematic approach where the clinic, it's just the style of a clinic that doesn't allow, a patient to really truly get the best care, or it just might be an availability thing of, hey, what do I have in the clinic? What do I have to use? If some of those things aren't there, we might find somebody else that might have those items, so we're able to, have the approach that we want.
That's awesome. The driving the PT and making sure that there's a high level of PT, I think, is so important. And it sounds like we've been talking more about the rehab side right now because it's off season, but in season, I assume is a little easier for you to manage a lot of this because you travel with the league as it goes from place to place. Is that correct?
Right. Yeah. So, it's a little easier to manage in the sense that we're constantly in front of them. So if it is somebody that doesn't live in an area that I am, or a friendly area, so to speak, where we know a lot of people who can check in on them, I am going to see them that following weekend, and make sure that we're kind of getting through what we need to get through. but at the same time, we're extremely injury prevention driven throughout the year. So honestly, I tell them all like, hey, I don't want to be seeing you on a constant basis, right? So, whatever we can do to make sure that you're not in front of us. We were joking around. I was joking around with our head physician at our exit physicals, and with a lot of the guys, we were kind of laughing and saying, hey, it's probably a good thing that we didn't get to know each other that well, because that means that you probably weren't necessarily injured, and everything that we're doing and implementing is working, right? So we're constantly pushing out, blog posts with, injury prevention and exercises for them to do to make sure that they're, staying healthy. We're looking into more of the strength and conditioning side to see how we're programming them throughout the week. Lacrosse is a kind of a crazy sport for a lot of them, because they're going a lot of them are going right from the outdoor league into an indoor league with about a month of time off in between those two seasons. So it's not really a true off season where, they might have this, good downtime to rest, recover, start a good, strength training routine to get as strong as possible, and then kind of morph that program into something that's a little bit more applicable to their sport. So we're constantly trying to innovate different ways to ensure that they're programming their routines properly and optimizing themselves as athletes.
I love when you talked about injury prevention, the two things you had mentioned was, one, education, it can come in many ways. And like you said, blog posts. And then two was, what does their programming look like? What's their strength and conditioning program look like? And how completed is it? We'll ask you a little bit later. We ask every guest what prehab means to you, but I'm just,
sure.
We could dive through that a little bit later. But,
cool.
You already kind of hit on it, but
give me a little time to give me a little time to think about that one.
You mentioned indoor versus outdoor leagues. I guess I'm unfamiliar with that. Are there different leagues that a lot of these players are playing in, and they're not just playing for the PLL?
Yeah, so there's the Premier Lacrosse League, which is the outdoor league that I'm involved with, but there's also the NLL, which is the National Lacrosse League, which is a indoor box model, where it's a little bit different of a game. It's obviously a smaller playing surface. They definitely play, the positions are a little bit different in the way that, there's not like long sticks out there for defense. Everybody kind of has a short stick. And so it's just like a different kind of style game. There's not a ton of players who can excel in both because they are a little bit different in that way. But at the same time, a lot of our guys are playing in it. So we have to make sure that we're managing them appropriately for both seasons.
Yeah, that makes sense. At first, I thought it was something like a NFC, AFC. I was like, it's the same game, just different leagues that maybe would come together. But I didn't realize they were completely different, not completely different sports, but definitely different, different dimensions. So it actually means that there's different requisites for each. So that's super.
Right. And I would say you probably want to be a little bit more, probably a little bit more cardiovascular shape and, that kind of stuff for the outdoor league, where in the indoor league, you probably want to bulk up a little bit more because you're in closer. Right. So, you can kind of get pushed around a little bit more. So, being able to manage, that, from a strength and conditioning perspective to, everything that's kind of involved with that is big.
Nice. So you mentioned strength and conditioning. You mentioned another sports medicine physician that you've worked with. What does a team look like from a allied healthcare professional standpoint for the PLL, and how do you, manage all that and get, how does all those relationships work for the players?
Yeah, so we have one lead physician who we work with, and she was, pretty much one of my first phone calls when, I became the medical director of the league. Lo and behold, she actually used to be a physical therapist earlier on in life, and then went ahead to medical school and then into the orthopedic surgery realm. So we have her, and then a handful of other physicians who help us out, who I've met through my travels with burton snowboards and some of the other things that I do. And I think, at the end of the day, we try to find like-minded people who are comfortable working in a multidisciplinary approach where there's just not the egos that you see in a lot of different scenarios. I mean, we're all there because we want to be there, and ultimately we're there for the players and for their health. So we're all able to really work together in that way. And then, I'm a obviously a physical therapist, so I function as also the head physical therapist of the league. We work and bring physical therapists from different local markets that we go into to try to establish relationships. I also have one of our physical therapists that work for Evolution, who is also a concussion specialist, lead that, where, she's able to manage basically our concussion program and making sure that we're up to date on all the latest protocols and how we're managing those. And then we also have a pool of about 6 athletic trainers who travel with us throughout the course of the year, who again, have an amazing role in this whole thing. And, they're obviously very player facing, people. So we want to make sure that we have the best there as well.
That's awesome. Yeah. You take it all the way from the top through the bottom, make sure you have, I guess you say, touch points with everyone, no matter where they may be at: prevention, rehab, performance. Sounds like you guys have a really good setup and a really good model right then and there.
Yeah. Awesome. And you never know where you're going to get the good idea. Right. And I think that's important, is having that open mind. I think that's also how I run the company, where it's, hey, everybody bring your ideas to the table. And although we may not use them all, everybody needs to be comfortable expressing their ideas and kind of knowing what their role and their places in the bigger picture of things, and bringing that expertise forward and being confident to do so. I think that's just kind of comes from a management sort of standpoint to really challenge everybody who's working around you to be confident in their ideas and not be afraid to bring them to the table.
Yeah. I mean, I think it's really important, giving, like you said, giving people the confidence to share, to speak up, because everyone has good ideas. It's just a matter of, do they get shared? Do people do you act upon them now?
Right.
If you get people to speak up, then we'll do it. So I assume you must have then spoken up on your career path to become to where you are. So I guess for a lot of the people that listen to our podcast, there's a lot of students, whether they're PT students or, even undergrad students. What was your career path like? What were some of those instances, when you spoke up or had an ideas, and how did that kind of alter, I guess, your career path from being an undergrad to then in physical therapy school to then?
Yeah, it's been a road, that's for sure. Definitely a road traveled. So I think that I was always the person that was, pushing the boundaries, pushing the limit, oftentimes to my detriment. Right. But I was never afraid to do it. I was, always one to voice an opinion, or to do first, kind of ask later. That's, my parents were probably a little upset with me earlier in life, kind of going through that.
That's how things happen.
And then
that's how things get done.
Things happen, right? Yeah. You gotta figure it. Yeah, everybody kind of figures it out for themselves. Yeah, and then I got the opportunity to play collegiate lacrosse, actually, but not that it's important that it was lacrosse, but the fact that it was a team sport, and being kind of accountable to the person who's next to you, and kind of learning all of those qualities, going through those first 4 years of undergraduate college, I think were extremely impactful in my life, and definitely ones that have translated over to my physical therapy career from early on in my career, when I was a clinician treating in a practice, to now where I still consider myself a clinician treating in a practice, even though that looks different, and obviously I have different job tasks, but I still consider myself just one part of the team, and that there's always going to be different aspects of that team that are going to be able to push the company and us forward. So, we run the PLL medical team in the same way, where we each, are the, one piece of the puzzle, and we make up this bigger collective that is really pushing, I think, the sport forward, but also our profession forward to, be out there at, and being able to be at the forefront of a medical team, I think is a little bit of a foreign thing to a lot of physical therapists.
Yeah, I think that is huge. I'm trying to think of all the other major sports. I'll be honest, I don't even know if other sports like the NBA or NFL, I assume they have one person that's a medical director of like a league. But then, like I said, it's different, because then there's a medical director for each team, I'm sure. But then when I think about it, I feel like a lot of times they are probably orthopedic surgeons or physicians, not
Yeah,
really
right.
physical
Yeah,
therapists. So it's,
yeah, I would say that's the traditional model for sure. And I think, one of the reasons that we were able to get this position is, we kind of pitched a different model that, started more with people who were front facing the athletes more often. And, as physical therapists and athletic trainers, we're just around the athletes every single day, working with them for, however long, and, doing all these different types of things. And I think, for that reason, we're uniquely in a position to create these really strong relationships with athletes. And so therefore, in my opinion, I thought that that's where we should start. Unfortunately, I think oftentimes when it works the other way around, you get a lot of athletic trainers and physical therapists who aren't quite up to the task of working with, the specific population. And so, and a lot of, what we hear with the team and the players that we work with is, they end up just not going to see those people, right? Because they haven't gained that trust, or, they don't feel like they can get them better. And I think that that's a very unfortunate situation that we were really aiming to avoid. Obviously, we work as a team, and so the orthopedic surgeons who we work with are, extremely important to our overall care, and we wouldn't be able to do it without them. So going out and finding ones that kind of fit into the mindset that we all have, who kind of work in this, really seamless interdisciplinary approach, is extremely important. And I value them so much in their expertise as well.
I think what you were mentioning before, how like some of the players you said on maybe some other leagues or something where the PTs may not be as adequately equipped to work with them, and then it's almost sad because then now the value to that player and to everyone that they know thinks, oh, well, PT can't do anything for me. When we can do so much for these people across
Right.
the continuum of where they may be in their physical injury, performance, whatever it may be, we can help them in so many different ways. And if there's that one bad, experience, who knows how long it'll be before they try to see a physical therapist again, if they even do, So
yeah, and it's important. It's why I love what you guys are doing with the prehab guys and everything that goes along, is dispersing information out there in a good way that hopefully breaks down a barrier to somebody being able to find us and knowing exactly what we do. I think so often, and it's across professions, right? If anybody has a bad experience, then they're less likely to use that service in the future. And I think that is extremely there in the medical profession. If you have a bad experience with a physical therapist, you're kind of soured to that. And it's all of our jobs to put out good information and make sure that we're breaking down that barrier so that people continue to come back to us and understand that maybe, hey, that just wasn't the right fit for you. And that doesn't mean that all people in that profession act that way or treat that way or whatever. And, I've had many failures as far as treating patients and otherwise, obviously, but specifically to treating patients where I didn't get, the patient better, or I didn't take the right treatment approach, and maybe another physical therapist could have done it a little bit better than me. But I'm constantly self-evaluating in those scenarios where I can then be better the next time around, right? And I think being able to recognize that in yourself will really help advance you as a physical therapist, and hopefully in your career as well.
I couldn't agree more. I think for me, as I'm learning more and more as a clinical physical therapist, knowing when to refer out. I know you want to be like, oh, I can help everyone. You have that like mindset. Of course I can help you. They don't even tell me yet what it is. It's your knee. Okay, of course I can help. Starting to identify those times earlier before it turns into something that, that now that's on me because I didn't send them somewhere else earlier. So I'm definitely doing that.
I've certainly been spoiled in the way that, I got the chance early on in my career to work with an amazing medical team with Burton snowboards, which, really started when we first went in, in the very first year. Basically, the medical team was 2 massage therapists. And that was, forget about, athletic trainers, physical therapists, there was no, physicians, orthopedic surgeons, nobody really kind of involved with that situation. And so we basically were able to, help and see that blossom throughout the years. And, again, I go back to myself being spoiled because I was able to work in this interdisciplinary approach where generally my clinic, I did have, an orthopedic surgeon sitting right next to me where I could do an evaluation. And if I was a little unsure or, maybe I was just completely clueless, right? I could call on those people to take a look at that athlete in real time. And now we're at the point where we're pretty much getting MRIs read on the field, less than 30 minutes after the person, takes the MRI. So, that's not really, true practice in most physical therapists' lives. But I think for me over those years, I really was just a sponge, and I would, really listen to how those orthopedic surgeons did their evals and, where they were placing their hands and, sometimes more importantly, how they were calming down the athlete and speaking to them and that, that bedside manner that goes along with it, because oftentimes this is like the worst point in that person's life from a physical standpoint, right? Like the first time somebody might tear their ACL might be the first injury that they've ever experienced. And being able to connect with that person on that level and, have them understand like, hey, this is a speed bump for sure, but we're going to get you through that. You're starting to have that conversation, potentially minutes after they injure themselves. And that mindset is crucial and also crazy in a way, that they're going through that. So, now again with Premier Lacrosse League, we're in that same environment where, I have an athletic trainer right next to me and an orthopedic surgeon right next to me. So who's ever the most equipped to deal with a particular situation is kind of who we're going to refer to in real time, and not having that mindset that I'm going to fix everything. I know everything, I can do this. I think once you're able to realize that about yourself and, get them, at the end of the day, we're working for the patient, right? Like that's what we're doing. We're there to help them on a path to, get better, whether if it's a rehab standpoint or get stronger, maybe from an injury prevention standpoint or recover, better after a triathlon or a marathon or whatever it might be. And so I think it's in the patient's best interest that, they understand that we're working for them and we're going to get them, to whoever we think is going to give them the best success to getting back to doing what they love to do.
Yeah. I mean, from a athletic or from a team standpoint, that multidisciplinary approach is, I guess you could say, so much more feasible than it may be for a lot of times in clinical practice. What are some suggestions you have for other clinicians out there, whether they're PTs, athletic trainers, strength coaches, listening, and how they can maybe try to replicate that model? Granted, nothing's ever going to move as fast or as clean as a professional organization, but what are some things as a business owner too of a physical therapy practice, or suggestions you have for other people out there practicing, I guess you could say, on the front line?
Yeah, I would definitely get out there and meet the other professionals that are around you. I think oftentimes, if we're talking about a strength coach to a physical therapist, there's oftentimes this stigma that, if somebody gets hurt with the strength coach and then they go to PT, that the PT is not going to send them back to the strength coach, right? So now there's a barrier that's created in that scenario. But if those two professionals just talk to one another, there's no reason why that person shouldn't go back to that same strength coach. You might just need to do things a little bit differently or look at it, through a different lens. So, for anybody who's out there just starting out in a new area, or even somebody who's been in practice for a long time, when you have time to get out there and do it, I would definitely be shadowing physicians, shadowing orthopedic surgeons, going and observing surgeries, going and, working and meeting the strength coaches in the area, or the speed coaches, or now there's a big craze with a bunch of people out there running like stretch labs and that kind of stuff where they're doing only stretching.
Yeah.
I would go meet those people, right? Like, I mean, I don't think there's anybody who I would be hesitant to go and meet, because often, pretty much every scenario you go to, you're probably going to learn something. And I think being open to that is important. I know everybody might not have, the capacity with their jobs to be out there, doing a ton of this stuff. But at the same time, generally in a physical therapy practice, you're working for 8 hours of a day. I'm sure you can find some time to get out there and work with another professional, at least for a few hours, every month or so, and learn and really absorb as much from them as you possibly can. Because, one, from a referral standpoint there, you're much likely going to refer to and from somebody that I think that just makes a whole lot of sense. And I think from a patient's perspective, they love hearing, oh yeah, I just, went and shadowed, Dr. So-and-so, physician last week, and I got to see how they do their evals and everything like that. And I think that just makes the patient a little bit more comfortable with you. And I tell a lot of our PTs, there's nothing like that first day that a patient comes in and you kind of ask them like how they were referred to either you or the practice, and they say, oh yeah, this physician told me I have to work with you, and they mention you by name, or this strength coach said that they only send people to you. That's a very empowering experience. And again, I think you're going to always get the best patient outcome if you have that network around you.
100%. Getting out there and meeting people is so important. And I think even if it's a different profession, like you mentioned, you may not pick up a quote unquote new manual skill, but there's so many other skills, soft skills. I think we're all in the same service type of industry with a provider and a patient. There's so many things that you can pick up and learn from how people, even if they're not related to, healthcare, there's just so many things from a service standpoint that you can pick up anyone, from so many people.
I was just going to say that, I can point to something that we do in our clinic often, where we're bringing people into our monthly staff meetings who had nothing to do with the healthcare industry to just talk to us about what they do for 10 minutes. And it was immensely beneficial for us to hear, some of these things and some of these jobs that people have, and then how that might, relate back to us as physical therapists. I think that there's always, a take-home message there when you get people talking about what they do in their own professions, and then you can relate it back to what you do. You said soft skills there, and I think those soft skills are so often overlooked and so important to us as physical therapists.
Oh yeah, 100%. It's like you could be the smartest person in the world, but if you don't have any communication skills, quote soft skills, it does not matter if you can't relate to that patient at all.
Yeah, absolutely.
Let's do this. Let's wrap it up. There are 2 questions I want to ask you. One of them I already told you. We'll start with the first one. What does prehab mean to you? And we talk a little bit about what you already talked before, or if there's anything else that comes to mind. So what does prehab mean to you?
Yeah, prehab to me means, anything that you're doing to get yourself ready for the next task that you're going to do. So it might be you're, doing a strengthening exercise to get ready for a surgery, but it also might be that you're, sharpening your mental skills, to focus for an upcoming exam, right? I think, the term rehab generally gets, kind of this connotation that it's obviously like after a surgery or after an injury. And so then prehab obviously would mean something that you're doing before surgery, before an injury. But I think that you can take that across the board to anything that you're doing in your life to obviously prepare yourself for that next task.
Love it. Love it, love it, love it. Next question, we'll finish up with this one. I already mentioned some really good advice regarding shadowing. Is there any other advice that you would give for, maybe up and coming students who want to follow a similar career path as you and work with athletes or with sports teams? Any general recommendations you have for those individuals?
Yeah, absolutely. Put yourself in the position to get yourself in front of these people. So for me, the Premier Lacrosse League gig that I have right now is solely due to myself volunteering at, different lacrosse tournaments very, very early on in my career, actually. It was like 8-9 years ago that I was doing this. And now fast forward 8-9 years later, I'm in front of those same people that I was volunteering and working with back then. And that's kind of how I was put in this position. So you never know when it's going to come. But if you want to work with high school athletes, you better get out there and get yourself in front of some high school athletes, right? Like go make friends with the athletic trainers at the high schools and make sure that they know who you are and, try to hang around there and see if you can learn something and, always go into these situations kind of without the ego. You don't need to tell people what you know, but more asking them what you could potentially learn from them. I think all of those things are going to be highly beneficial to, eventually working with the population that you want to work with.
Awesome. Thank you so much, Mike, for your time. That was really, really solid advice for those students that are out there listening. Really, really, really solid. Let's do this. How can people get in touch with you if they want to reach out to you outside of here or, directly?
Yeah, for sure. I mean, my email is probably the easiest thing. I don't think I would get my cell phone out on the podcast, but you talk to me enough, I'll probably give it to you. But yeah, my email is mike@evolution-pt.com. My Premier Lacrosse League email is mike.giunta@premierlacrosseleague.com. Spelling my last name is Giunta. So those are probably the two best ways to get a hold of me. Obviously my Instagram is Mike Giunta PT. So you can kind of follow me on there and see kind of some of the things that we're doing with these different sort of athlete populations and how we're really trying to push the limits of the profession.
Sweet. We'll make sure to include those in the show notes for everyone. Mike, best of luck in the 2021 season. It sounds like you're also really busy with Burton, so that season's right around the corner. So
that season's coming up. So yeah. Exactly. Time to get a little cold, right?
Yeah.
Get out there on the mountain.
From the field all the way to the mountain.
That's right, Mike. That's right. Well, I really appreciate you having me on here. And, I think it's great what you guys are doing and getting all this information out there to everybody. So, keep up the good work on your end. And, we'll be looking forward to seeing you guys as leaders in our field.
Appreciate it. Thanks, Mike.
All right. Take care.
That was an amazing episode. Mike touched on so many good points that we truly believe in as well. As physical therapists, we have the ability to impact our patients, our clients, our athletes, the person in front of us in so many different ways and across the continuum of where they may be. Mike's definition of Prehab is straight up on point with what we believe Prehab is as well. It's getting you prepared for whatever your activity may be. For those of you that are interested in learning more about the PLL, you can go to the website. It's in the show notes. I've also included Mike's email in the show notes as well. It is a great recommendations as well for those of you that want to go into sports PT or want to work with big teams. And this holds true across all fields. If you're an athletic trainer, if you're a physical therapist, hey, even if you're not in healthcare, you can listen to this podcast and you want to move up the ladder within your business rank, your corporation, spend time with people above you, spend time with people below you, spend time with people in other fields because there's always something you can learn and pick up on. Really hope you guys enjoyed this one. If you did, please rate, review, and subscribe it. Just take a screenshot of us. Take a screenshot of your phone listening to it right now. Tag us. Tag Mike Giunta at Mike Giunta PT on Instagram. Let us know if you liked it. Again, the reviews really, really help us.